whether there's access to abortion or bans on abortion, the number of abortions tend to be the same.
As conversations continue over overturning abortion legalization across the U.S., there are still things experts say could be done here in BC to ensure better access locally. Michelle Fortin, Executive Director at Options for Sexual Health, says there are sometimes challenges for those who don't live near bigger cities.
When you get into rural and remote communities and some places where it's a little more conservative, access to abortion or the willingness even of physicians to identify as a provider is limited. And when you consider that medication abortion, which allows someone to take a pill in the comfort of their own home in a time that works for them, is only applicable in people who are pregnant under 10 weeks, it means that we need access to that quickly.
This is unpublished data, but almost half of abortions in BC are currently medical abortions. So it's a little harder to figure out if you're someone seeking that option, where do I go to access care?
UBC's Dr. Sarah Monroe with the Department of Obstetrics and Gynecology says telehealth referrals to get medical abortions are a more accessible way for people to get access in BC, where you speak with a local doctor online, get a prescription, and fill it at your local pharmacy. But she worries that requires access to the internet and knowing you can speak to a doctor remotely.
We already had really great telehealth services for medical abortion prior to COVID. So in BC, that's an option, but people maybe aren't very aware of it.
MLA Grace Lohr advocated for improving access to resources across BC at the provincial legislature on Tuesday morning.
Our government has taken important steps to support access to safe abortions, including providing universal no-cost access to medical abortion and stocking it in rural pharmacies. There is more to do, especially with access in rural areas, and our government will continue to work to support and improve access across the province.
Already, I'm hearing from a lot of women who were active in the pro-choice movement in the 80s and in the 90s and even before that, are getting in touch with me. Women MLAs are bonding together. We need to be very vigilant and not let this get out of hand.
Ashley Burr, City News.